if you're a parent and you want to be a good parent, you need to do your own research about everything today, because everybody's lying to you.
So there's this idea floating around from the anti-vax handbook that pediatricians recommend vaccines for the money, because apparently we're all about bonuses, foot traffic, metrics, and funding our yachts. Let me break this down as a pediatrician and mom who's practiced in 2 different states and who has trained in 4 different states. And if this resonates, please share it. First off, pediatricians are the lowest paid specialty in medicine. Think about that for a second. If vaccines and bonuses were lining our pockets the way these claims suggest, wouldn't we be one of the highest paid doctors out there given the amount of vaccines kids get? But we're not, because this narrative is pure propaganda aimed at undermining a specialty that's dedicated to keeping kids healthy and out of hospitals.
Typical pediatrician's office makes about 50% of its funding comes from vaccines, not actually from selling the individual vaccines, from the traffic. And today, every kid goes to the doctor at least 10 times to get their vaccines, and that foot traffic in and out of the office is a major part of the business plan for the pediatrician office.
Let's talk about what really happens in a pediatrician's office. Vaccines aren't some cash cow. They're actually costly. Practices have to buy, store, and administer vaccines under strict temperature controls using expensive equipment. And here's the kicker. Insurance reimbursements often barely cover those costs. Remember how hard it was to find COVID vaccines for your kids? Maybe not for you if you're watching this and you don't vaccinate, but that's because vaccines are expensive to store and maintain. Many concierge or private practices can't afford to stock them and refer patients to federal programs instead. So if vaccines were making us rich, wouldn't we all be rolling in cash? Spoiler alert, we're not. And as for the foot traffic argument, parents don't just come to us for vaccines. Do people forget this? They come for comprehensive care, developmental checkups, managing chronic conditions, treating illnesses, and more. Vaccines are one important part of the job, but far from the whole story. So no, vaccines aren't paying the bills. Well visits are. Pediatric practices rely on well visits because they include developmental screenings, growth monitoring, and preventative counseling. Things reimbursed at higher rates than sick visits. Vaccines are just one piece of the puzzle, not the driver of revenue. Trust me, as a mom and doctor, I don't want to see sick kids in my office, and vaccines can help reduce that risk.
And they're also then rewarded by Blue Cross Blue Shield, which has a reward schedule for pediatricians who vaccinate 80 or 85% of the kids in their office, get these giant bonuses, hundreds of thousands of dollars that they make.
Yes, some insurance companies offer small quality incentives to encourage preventative care. Why? Because vaccinating kids saves everyone money in the long run. Fewer hospitalizations, fewer ER visits, fewer long-term health complications. That's good public health policy. And yes, some insurance companies reward evidence-based decisions, and these are tied to multiple metrics like well visits, developmental screenings, and following evidence-based guidelines for things like asthma and obesity, not just vaccination rates. But let's bust this myth wide open. Pediatricians are not rolling in 6-figure bonuses for vaccinating your kids. According to Blue Cross Blue Shield and other sources, any incentive programs are tied to multiple metrics like well child visits, developmental screenings, and overall quality of care, not just vaccination rates. They're designed to reward comprehensive preventative care that improves outcomes for children and reduces healthcare costs overall. Let's also put this into perspective. The total payouts to practices are not significant enough to influence clinical decisions, and they are definitely not hundreds of thousands of dollars per doctor, as some claim. Again, if this was the case, me and my colleagues would be on yachts in the Bahamas, and we're not. We're here debunking this BS over and over.
And that's why they throw you out of the office if you fight back. It's not because they care so much about your particular kid. It's that you'll throw off the metrics and you'll lose them their bonuses. Part of the responsibility of being a parent is, unfortunately, is to not trust everything your doctor says.
When a pediatrician asks a family to leave because they refuse vaccines, it's not about metrics or money. It's about protecting vulnerable children in the practice. In every pediatric office, there are children who rely on herd immunity, babies too young for vaccines, kids with cancer, undergoing chemo, or those with rare immune disorders. These kids have no defense against diseases like measles or whooping cough, and they rely on the rest of us to stay vaccinated to keep them safe. When a family refuses vaccines, it breaks that shield of protection, not just for the child, but for the entire community the pediatrician is entrusted to safeguard. And then there's trust. A strong doctor-patient relationship depends on mutual respect and a shared commitment to evidence-based care. When a family consistently rejects proven life-saving recommendations, it can break that trust. How can I as a doctor provide effective care if my expertise is constantly being dismissed? Let me be clear, dismissing a family is always a last resort. Pediatricians spend countless hours counseling families, answering questions, and addressing concerns. But when those efforts fail, We may suggest another provider who aligns better with their beliefs, not because we don't care, but because our primary responsibility is to protect every child in our practice and provide evidence-based care that benefits the greater good. Here's the bottom line. We don't recommend vaccines for the money. We recommend them because they're life-saving, backed by decades of research, and proven to protect your children. So the next time someone says, pediatricians push vaccines for the money, ask them this. If that's true, why aren't pediatricians the highest paid doctors? The truth? It's not about money. It's about protecting children. End of story.